Hi, this is Brittany Willis, and this is my presentation on generalized anxiety disorder. First, I'm going to talk about the etiology of the disorder, or the causes. There are three main components to that: genetic, environmental, and psychosocial. First, I'm going to focus on the genetic. So there's not one specific gene that is linked to anxiety disorder. Instead, it's a collection of genes, then combined with environmental or social factors or life events that may set off a response. The CFR system has been linked to anxiety because of its effects on the limbic system. I will get into a little more detail about the limbic system later, but basically it is our brain's response to fear, emotions, worry, all these things that come into play with the disorder. The environmental causes, so external factors, may trigger genes causing anxiety to manifest. So like I said before, certain events or things that happen in your life may trigger these genes to then cause that anxiety to manifest. BIS, or Behavioral Inhibition System, and FFS, which is your fight or flight system, can be triggered by major events. And smoking has actually been linked to anxiety. People who had smoked when they were younger, it was more common to see that they developed anxiety later in their life than people who did not smoke. Psychosocial, so when we're younger, as babies really, a sense of what is in our control and out of our control starts to develop. So people who struggle with that later in life maybe weren't exposed to that enough as a child. A lot of that can be parenting styles. So if a parent is overprotective, that child might not learn coping skills. And a lot of it can be conditioned response. So certain triggers and reactions can be conditioned over time. Some symptoms of the disorder include intense or excessive fear and worrying, and it actually interferes with daily living. Somebody might have panic attacks, and there are actually physical symptoms: restlessness, being fatigued, difficulty concentration, having a blanked mind, irritability, muscle tension, insomnia, and sleep disturbances. Those can all manifest within somebody with a disorder. And the diagnosis criteria for the DSM-5 is pathological worrying that occurs for more than 6 months. That is for adults. With children, I believe it's 1 month. It has to affect daily functionality, so this should affect somebody's day-to-day routine, their daily tasks, to the point where they can no longer function. These symptoms cannot be attributed to substance use or better fit criteria for another disorder. And as I mentioned earlier, 3 or more of those physical symptoms must be present. With a child, I believe it is only 1 symptom. This disorder does cause biological changes, both neurobiological and physiological. For neurobiological, as I mentioned earlier, it affects the limbic system. So your limbic system is a part of your brain with your amygdala, your hippocampus. It's really the part of your brain that controls your fear response, your emotions. So when your amygdala is overactive, you're going to experience intense stress, fear, worrying. And as I mentioned before, that fight or flight system is so important. And somebody with an anxiety disorder, that system may be triggered for things that it really shouldn't be. The physiological changes, people with this disorder, I found this surprising, are actually more chronically known to have like muscle tension. They did studies, and people who had the disorder had muscle tension where people who did not. So I thought that was really interesting. They do have a tendency to be more tense. And that is kind of related to the childhood upbringing and the coping strategies. And then they also might be less responsive to heart rate, blood pressure, skin conductance, and respiratory rate. So it really is affecting the bodily systems as well. Some treatment approaches. For medication, benzos are commonly used. So they're the most commonly prescribed medication for this disorder. They're usually used in a short-term use, so really not for long-term, and there's a lack of studies beyond 8 weeks of use. The risks do include cognitive and motor function, and it creates a dependency and has addictive qualities, so a lot of people do have trouble getting off of the medication once starting. So overall, benzos are kind of used for a more short-term, quick fix. Cognitive behavioral therapy is another treatment known. It's known as CBT. This is a treatment that's better used for long-term effects. It teaches people to cope with the stressors and learn how to work against their triggers. They confront their anxious thoughts, and a lot of times images are used because during the times of stress, there's often images that people are avoiding that correlate with that stress. So in CBT, they use those images and kind of make people confront them and learn to feel through the process rather than avoid it and over worry. And finally, some new treatments that have been used is mindfulness-based therapy. So this might include meditation, mindfulness, yoga. The good thing about this treatment is it can be used with others, both medication or psychotherapeutical. So it definitely has its benefits and will increase over time. And these are my references used. I used our textbook, and I also used the DSM-5 manual. Thank you.